Here is the restored aspect of the x-ray where we saw where they attempted the sinus graft. And just look at the prosthetics here. I don't know if you can tell on the screen, but it's very kind of chalky looking. It's very opaque. It does not look real at all. And it just doesn't really fit in her mouth. It's aesthetically, it's just not that great, and it looks fake. And so again, we here at Trust Implants, we are about restoring the aesthetics so mimic nature. So biomimetics, we want to mimic what's been lost, and by providing ideal biomechanics and ideal aesthetics, we're able to achieve those goals. So take a look at one of our prostheses. So this is a All-on-6 Zirconia prosthetics, but look at how beautiful that porcelain is. Look at the tissue. Everything just looks natural. And in the patient's mouth, it looks amazing. Look at the mechanical side of it. This is the underside of the prosthesis where it attaches to the gum tissue. And you can see how beautiful that is and how clean it is. So, you can imagine as once this goes in the patient's mouth, food, debris, plaque, bacteria can harbor under. You want the surface to be really highly polished and kind of reflect and push away that debris and that bacteria, which is what this zirconia and a really quality material does. It rejects the bacteria, it pushes it away. Versus something like this where you can see there's actually rust on this underneath on this bridge. It's broken. There's a lot of debris, a lot of material or plaque, and everything is collecting underneath because one of the design and two of the materials. So the design and the materials, the execution, the placement of the implants are all critically important when we're dealing with these sort of wonderful transformative cases, but they have to be executed properly. Here is another All-on-4 case, broken case. This case is obviously finished. There's a titanium bar in the framework, a framework wrapped with acrylic and denture teeth, but it's broken. And so, and it's broken and you can see there's no molars. The molars that should be extended back, there's no support back there. So if they were to try to even extend to the first molar, it would break without a doubt because the cantilever is way too long. And having that long of a cantilever is just a recipe for disaster. Versus putting an implant back there, now it's no longer a cantilever. You've redistributed the load factors so that it's a much more favorable long-term result.